Hi, this is Dr. Cameron Afzal from Metro Vein Clinic. Today we are going to talk about what is free screening. You see all these billboards, you see these ads on Facebook, you see uh, websites advertising free screening event or free screening. So what does that mean? What do you get in a free screening? Second thing I'm going to talk about is what is the vein clinic? What's the big hoopla about, hey, there's a vein clinic here, come to our vein clinic. What does it really mean? So before I talk about this, I'm going to tell you a little bit about varicose veins. Why is it important and how it changes a person's life. Uh, the blood is pumped by the heart, and the heart takes the blood to the liver, kidneys, legs, etc. And then the veins bring the blood back to the heart. When the veins are bringing blood back to the heart from the feet and the legs, the blood is going against gravity. There are these one-way valves in the veins that prevent the blood from falling back down with the effect of gravity. This you can see in this diagram. Now, when these valves break, and that can happen because of pregnancy, because of genetics, and a whole bunch of things, when these valves break, the blood starts to back up and leads to congestion in the legs, more like a traffic jam. This congestion or traffic jam in the legs causes a person to have achy, tired legs. At 11 o'clock or 2 o'clock in the afternoon, the legs feel achy and icky and tired and feels like there's pressure in the legs, mostly around the calves or near the feet. There can be burning sensation in the feet. In addition to that, there could be restlessness of the legs. In addition to that, patient may find that when they take the socks off in the evening, they have imprints of the socks on their ankles or their calves, and that is known as swelling. So these are the symptoms that can happen. And now, if you fix the problem of varicose veins, you have to have it done at the right place. And one goes to the right place, these veins can be fixed. The problem of congestion can be fixed, and the tiredness and fatigue and the swelling and the night cramps and the restless leg that comes with it can be improved or fixed. Now, remember, a patient may have one of these symptoms, may have more than one of these symptoms, but a patient may not be able to look at their legs and say that they have varicose veins, because sometimes the varicose veins are ropey, like you see in this picture, and sometimes the varicose veins are not visible, and the only thing that is certain are the symptoms that the patient is having. They can have the achy, tired, cramping legs, or they can just have achy legs, or they can just have tired legs at the end of the day. The patients can just have night cramps. The patient may just have restless leg. And when they look at their legs, they see nothing or wrong with their legs, and they may or may not have spider veins. Now, that is where the free screening comes in. A free screening in our clinic, and we do it slightly differently, is a process in which we can help the patients that feel like they have symptoms but don't see varicose veins. We can help these patients by looking at their legs and figuring out if they do or do not have varicose veins. In a free screening appointment, you get to see my very experienced nurse who has worked with me for 7 years. She does a lot of our sclerotherapy, and then she also does most of my big procedures with me. She's my first assist, and she essentially runs the clinic, the clinical part of it. The patient will see her. In that visit, she will go over the history, meaning the symptoms that a patient may have. She may look at the legs based at her discretion, and she will decide if the patient has varicose veins or patient does not. Now, if she sees symptoms and she does not see varicose veins, she'll probably use the ultrasound to look at the veins that could be varicose that may not be visible through the naked eye, and she will look at them, and then she will decide if a patient has varicose veins or not. Now, this is a free appointment in a service for a patient that helps them figure out why they have leg pain and discomfort, and why do they feel the way they do even though they see no problem. Because most patients with this problem do not get an answer. And at that time, she can make a recommendation if it would benefit the patient to come into our clinic to be seen as a new patient. Now, we will have another video coming up right after Labor Day that will talk about what a new patient appointment is. And in that video, I can also talk again about free screening and how it is different, and which patients should make a free screening appointment and which patients should make a new patient appointment. And again, I'd like to say that, leg pain and discomfort, achy legs, tired legs, they can be a problem of the past. And a good way to start is to go look at our reviews on Google and Facebook. And thank you for watching, and do tell me what you had for breakfast, because that's how I know that you have seen this video to the end.